Good afternoon, I'm Zahir Abbas. I'm a physician associate trainee. Can I confirm your full name and date of birth, please?
Sarah Smith, 1st September 2000.
Lovely, Sarah. Pleasure to meet you. So, Sarah, I understand you're here because you've been referred and you've decided that you want to stop smoking. Is that right? Congratulations. Well done on making the decision, first and foremost. I think it's a very big decision, a very difficult one, so well done. Might I ask what motivated you to make this decision on this occasion?
Just decided it's enough.
Oh, very good, very good, very good. Oh, wow, I'm amazed, I'm impressed. Very nice. And have you tried before?
Yeah.
How
Twice.
many? Twice, okay. Yeah. And how long ago might that have been?
6 months ago,
Okay.
maybe a year before that.
Okay, okay. And if you don't mind me asking, what happened? What kind of
Social life, friends.
Okay.
Very easy to slip back into.
Okay, fine. So your friends smoke, do they?
Most of them, yeah.
Okay, fine. Okay, we'll discuss that in a few moments. Who do you live with at home?
Flatmates, friends.
Family at home?
Yeah.
Little ones?
No,
Not
not yet.
Very good. How about nephews and nieces in around you? Got nephew and nieces living around you? Yeah. Okay. And how about do you have a partner?
Yeah.
And does he or she smoke?
Yeah.
Okay. He, sorry? Or
He.
He smokes as well, does he?
Yeah.
Fine. Yeah. Okay, fine. I think just before we continue, one of the important things I might suggest while I've got the opportunity is it's always, if you haven't already done so, it's always good to tell your family and friends, especially your partner, that you're trying to stop. And they might change their habits a little bit. They might actually leave the house to smoke, etc. In purely in respect of you trying to quit. And sometimes what we also find is you become an ambitious drive for them as well. And sometimes you can actually support each other to actually stop smoking. So absolutely do that if you haven't already done so. Some people actually keep it a secret. My advice usually is go and absolutely tell them so that they can actually support you and not smoke around you. I mean, we can see quite evidently on the previous two occasions. Did you try to go cold turkey on the previous occasions, or did you try to just reduce the number of cigarettes?
I think I tried cold turkey the first time, I couldn't do it.
Okay.
So the second time I tried to reduce it, but
okay. Absolutely, and you tried both methods. So a couple of things. First and foremost, very few people actually succeed on the first attempt. So don't at all be demotivated or otherwise disappointed. And secondly, what we find evidence does actually suggest going to cold turkey is significantly more chance of actually achieving the cessation than actually tapering it off. Okay, so perhaps we could maybe consider going that way again on this occasion. What are your smoking habits? I mean, what do you smoke?
rolled.
Just tobacco, just standard tobacco, yes. Okay. And how many a day might you smoke? 10 a day. Okay, fine. Yeah. And is there any kind of routine or pattern as to how you when you might smoke these?
Socially mainly, but probably also after food.
Okay. Yes. So after a meal, lunchtime, tea time, breakfast, after breakfast.
Yeah.
Okay. And how about any triggers that you might find? Do you find you are triggered by any particular event or otherwise?
Stress usually.
Okay. And what did you remind me, please, Sarah?
I just work from home.
Okay. And are you working in an office or otherwise?
Yeah.
Office-based work.
Office-based work.
Okay. And is it quite demanding? Is it? Okay. So and how are you with your cravings? Do you find you suffer from cravings at all? Do you? Okay. You've not sought any help in the past, otherwise, to actually. So I think what we might consider doing is there are three options. There is what we call the NRT. You might have heard of nicotine replacement therapies. So that comes in different forms: gums, lozenges, inhalers, nasal sprays, the various forms. My advice usually might be to perhaps go with a gum. I can see you enjoy chewing, so a gum is probably good. The thing to remember with the gum is actually you're meant to chew it as little as possible. Okay, your idea is to just place it between your cheek and your teeth. And with these gum, the nicotine replacement gums, what happens is when you feel that craving, when you feel that need, you actually then chew it. And what it is, it releases a surge of the actual nicotine, and that's what then actually calms everything down for you. So you actually get that craving dealt with in that way, and then you just leave it again, let it sit on the side. Whereas most people, what they end up doing, they keep chewing all the time, and they're just constantly releasing the actual replacement that is. So that's your lozenges are in equal fashion. You don't have this habit of, or this craving of having to do this tendency of having to do this, because that's when the inhalers come handy quite nicely. And again, the other thing I'm thinking is the medication. Have you heard of something called Zyban or bupropion? Okay. So strictly speaking, it's an antidepressant, but it's actually the best option in the given context for smoking cessation to actually deal with the cravings. Okay, I just need to make sure you don't suffer from seizures at all. Right? So it's about a 9-week course of your protein, and we're going to taper the dose and modify it along the way. But it will absolutely deal with your cravings quite nicely. So that's probably one of the best things. Are you familiar with the risks and benefits associated with the? Okay. I mean, you're probably familiar with the risk of smoking being cancer. Namely, that's lung cancer, the biggest one. But I think some people forget the possibility of developing throat cancer and even oral cancer. The other real concern we see in much older patients, so after many years of smoking, is a development of COPD, which I'm sure you may not have come across, and that then carries its own issues. The advantages are manifold. I mean, least to say the health, your health benefit, and it's never too late to quit. The body will reverse the changes that have already been made. You're very young, you're 21, so you're not doing much damage at all to your physiological. Otherwise, money. You save a lot of money. I'm sure you're probably familiar with that one. And the other thing is, I think you mentioned nephews and nieces being around, and unfortunately, these young innocent children, they can, they are exposed to passive smoke. So by stopping, you're actually benefiting them as well, and any pets you might have in the house. So huge advantages. Did you have a quick date in mind at all, or did you just want?
I haven't decided yet.
Fine, but you want the kind of soon as possible, or sooner rather than later?
Yeah.
Okay, wonderful. So what we'll do is I'll go away and I'll get some information for you regarding the NRT, and we'll get a prescription made, and same for the bupropion. Is that okay? And we can go forward with that. Any questions at all? Wonderful. Thank you for your time, and I'll be back in a few minutes.